Hi, my name is Lily Jackman. I am the LVAD coordinator for the New Mexico Heart Institute and the Heart Hospital of New Mexico. Today we will be going through the driveline dressing change that you and your caregivers will be performing in your home. This is part of your LVAD training program after your HeartMate 3 implant. All right, so to get started, you're going to have your family member lay down in a comfortable position. Make sure that you can easily access the site, and make sure that anyone within the room is going to be either applying a mask or a hair bonnet, which is going to be located inside of the kit. You want to always look at the initial dressing and look for any drainage or signs of bleeding. This is something you'll want to call your LVAD coordinator team about. And then you'll also want to just make sure that you have all the parts that you need. Today we are missing our anchor, which we will be applying at the end of this video. So to get started, we will have our kit, which is going to be mailed to you through a company called Continuum. And we're going to remove our kit. You can open it via the paper. You just rip it open. The first layer of this kit is going to contain your masks, a hat, and some gloves. So first, you'll want to put a hat and a mask on you and your family member. So we'll put it on your family member. And this is to protect from any germs that may be in the hair or in your breathing from touching the site. Anyone within the room should also have a hat and a mask on. If they do not, just have them go ahead and step out of the room until you're completed with your dressing change. Okay, so now we'll go ahead and apply our clean gloves, and that's gonna be the gloves we wear to remove the old dressing. The difference between a clean glove and a sterile glove is that clean gloves, they are clean, they're not filled with germs and dirt, but they're also not completely sterile where they have zero bacteria like these gloves inside of this package. So we use our clean gloves to remove the old dressing. We're going to use sterile gloves to apply the new dressing. So now I'll go ahead and show you how we're going to remove the old dressing. Okay, so now we are going to go ahead and remove the old dressing. I have applied my clean gloves. I'm going to go ahead and start. There will be pants on here you will need to remove. This patient does not have his pants on, but that's okay because we're going to put new ones on afterwards. Just being careful of the skin. If you notice skin irritation, just call your LVAD team because we do have tricks to help with any irritation after you've been changing your dressing. So just communicate that to your team. This disc, if it does not come off naturally with the dressing, you can just reach in and pull it off. And then you want to always visualize the site. Make sure there's no redness or drainage. If there's anything new or it looks irritated or different, go ahead and have your family member take a picture of it. So that way you can send a picture to your LVAD team and then give them a call. So now that we've removed the old dressing, we've examined the site for any signs of infection. I'm going to go ahead and remove my clean gloves. You can remove these, keeping the contaminants in by reaching your finger inside the glove and pulling it inside out and then throwing those away. You'll want to open your sterile field by only touching the blue. Anything in the white area is considered sterile, therefore should not touch anything other than your sterile gloves when we open that up. So pinching the blue to open this, and pinching the blue to open this. You'll want a nice clean surface area to set up your sterile field on. Once that is set up, you can go ahead and move over to your sterile glove. So your kit is going to come with 2 pairs of sterile gloves of size medium and large. If neither of these sterile gloves fit your family member, we can always add in an additional prescription for another size. So just let your LVAD team know if these gloves do not fit the person that is going to be changing your dressing. All right, so we're going to go ahead and open your sterile gloves. On the outside, you can touch this. This is non-sterile, so you're going to unfold, and then open up. So here, you're about to create your second sterile field. So you'll grab the edges of this and just open this up, getting yourself a nice surface area. You're going to use your left hand to reach and grab the inside of your right hand's gloves. pulling this over your hand and onto your fingers. If you get your fingers messed up, it's okay. I don't want you to reach and grab and touch them. Just leave them alone. We'll fix them after, because if you reach and grab this, that's breaking your sterility of your glove. Now you're going to use your right hand to reach inside of your left glove, creating a little pocket for you to slip your left hand into the glove. Now, if I had messed up fingers, I could touch both gloves and get them nice and fixed. Now you have your sterile gloves applied. Now we have our sterile kit is open. We have our sterile gloves on. Because these are sterile and your kit is sterile, you can now touch the contents within your kit. Just to review what's in here, you're gonna have 2 chlorhexidine lollipops. That's for cleaning. They are for antimicrobial surface area cleaning. They're gonna keep bacteria from growing underneath the dressing. We have a skin prep, which helps the dressing stick to the skin better and protects the skin from irritation. We have your Silver Lawn antimicrobial disc, which is gonna go silver side down on your family member. We have a saline wipe that we're gonna use to clean the driveline and also wet the disc a little bit. And then we have your dressing. So now I will be going through how we're gonna apply this dressing onto your family member. So as you start going through the process of applying your dressing, I want you to always have your hands in view. That way you know you're not accidentally touching your body parts or his body parts and breaking your sterile gloves. Step 1, we're gonna take our chlorhexidine lollipop, the first one. Open that up. And we are going to clean the site, going from the inside all the way out. Always while keeping your hands in view. Now that you have a nice wet surface area, we don't want to take this and go back into the middle and clean it, because you're gonna take all of these germs that we collected and put them right into the middle. So now you're done with this lollipop, just toss it away. We're now gonna take our second lollipop and do it again. Starting from the inside. And if you need to use your second hand to lift your driveline up to get underneath, that is okay. Just keeping in mind that this is now your clean glove hand while this is your sterile glove hand. You're gonna go all the way out. All right, now while that dries, we can continue down our road of items. We're going to go ahead and open up our silver disc. Now we can use our still sterile hand to take the disc out. And we are going to put this around our driveline side, like so. So silver side is down, very important part of this process. And it's just gonna wrap around the outside of that driveline. It does not matter where this slit lands, as long as the disc is in place and it's not gonna move. And notice as we're doing this chlorhexidine is drying. You never want to put a bandage over a wet chlorhexidine surface, because that can create a lot of skin irritation. So this is drying. We can now get our saline wipe, and we're going to open this, and we're going to use this to 1, clean the dressing, and 2, to get the disc a little bit wet. Getting the disc wet activates the silver, which is what's going to protect you from infections. So using your clean glove hand to lift your driveline, you're just gonna squish a little bit of fluid onto that disc, and then starting from the first exit site, you're gonna clean all the way out, getting it nice and clean. Now, we do not want to go back and put this back in, right? Because then we'd be taking all of these germs and putting them right into your family member's driveline site. So once we're done with this saline, we can just toss that away. Now we want to make sure everything's dried, and then we can move on to our skin prep. That's the one that's going to help stick the dressing and protect the skin. You open up this lollipop, and this is going to go around where the tape's going to touch. So about a couple inches around the exit site. Now that is going to settle in. We do have gauze in this kit. There's 2 slitted gauzes, and then there's 1 non-slitted gauze. These gauzes are just optional. If your family member had an infection or had some bleeding, you can utilize the gauze by putting it around the site like so. If your family member's site is healed and it does not require any kind of, or it has no drainage present, it does not require gauze. So go ahead and leave that off to allow the site to breathe more easily. Now we have our skin prep on, our silver disc is moist and wet and silver side down, and our chlorhexidine is dry. So now we can get our dressing ready. Now what I want you to do with this dressing is, one, ask your family member where they would like the exit site to face. They could have it coming out this direction, just wherever's comfortable with their clothing and with the gear that they are wearing. This might take some different playing with to find the spot that they enjoy the most. So you'll want to face the slit out where they want it exiting, the direction they want it exiting. You're gonna place this with the paper side down, and using your hand, you're gonna anchor the dressing and pull the paper. And this is what's gonna allow the paper to fall off and the sticky part to touch onto your family member's skin. Then you're gonna go ahead and do the same thing on the other side. Now this is gonna fall off. You can go ahead and adhese that down and make sure that it is an enclosed circle, and with the disc right in the middle of that window so we can see it. The last step is the pants. We'll go ahead and put pants on underneath the disc, or underneath the drive line, excuse me. You're gonna pull one corner, allow that to fall in. You're gonna pull your other corner and allow that to fall on. There's your drive line dressing. You can just throw this part away, or you can use it to write a date and time on and stick it on as a sticker. The last step we have is just to apply the anchor. So the final step of our drive line dressing change is to apply this anchor. You're gonna grab a Foley anchor. This does not have to be sterile. You're going to open it up. If the skin is feeling a little bit oily, you can use the alcohol pad to dry out the skin a little bit. And then it also comes with some skin prep to help stick the anchor on. This patient is very dry, so I'm going to skip both of those, but those are optional items. So on this anchor, you're gonna want to place it somewhere where the patient is comfortable or your family member is comfortable. So it's either gonna be up here, likely it'll be a little lower, less close to the armpit, or you can do it down here, just wherever's comfortable. On the back is also a good spot. For demonstration purposes, I'm gonna put it up here where you can see it. So this also has tabbies, so you could anchor your anchor from one end, let it fall into place, anchor it from the other end, let it fall into place. You're then gonna bring your drive line, and you're going to, on one end there's a hole, the other end has the thing that you're gonna push through, the little plastic piece. So you're gonna pull this plastic piece into this hole. Pull it all the way through until it pops through and catches. Now, if this patient were to drop his equipment, the most of the heavy weight will land right here rather than our exit site. We want to protect that exit site from trauma, because trauma is the #1 reason we have infections. So whenever you're gonna get your family member, your patient up, make sure there is an anchor in place. It is intact and the tabbies are pulled through. It is not falling off, and then you are ready to go. So now we have completed our review of the drive line dressing change that you will be doing at home. Now the frequency of these changes depends on you and your family member. They are often daily until about 3 weeks after surgery and the site is healed, and then it can decrease to every other day or every 3 days. The main important parts is that anytime you take a shower, the dressing needs to be changed. So prior to showering, you'll want to inspect the dressing, make sure there are no leakages or areas water can get into the area and touch the exit site. Water can be very dangerous to driveline exit sites because of the bacteria that lives within the water. So you'll want to make sure that that dressing is nice and intact before putting your family into the shower. After the shower, you'll go ahead and change that dressing within 30 minutes. So a lot of times the frequency of these dressing changes lands on the shower schedule. So if you're a daily shower patient, then you're gonna be changing your dressing every day. If you shower every other day, you're gonna change it every other day. Before your shower, I want you to always remember to apply your anchor and make sure that anchor is intact and strong, and make sure there's no leaking, and then change your dressing immediately after. If you have any questions about the steps we have gone over today, if you have concerns regarding showering, the exit site, or any other questions, please reach out to your LVAD coordinator and your LVAD team. And you guys all have a wonderful day.